So anesthetizing, get the bird's whole head in to the mask, and then I make sure that I have a good seal around it with my hand. And I generally start them out as far as with pre-oxygenating them for about 2 to 3 minutes, and then go up in small increments on the gas anesthesia. So start out for 1 minute at half, and then another minute at 1, and generally they go down when it's at about somewhere between 2 to 3% on isoflurane. So this is probably going to take just a couple minutes here as far as with getting her completely anesthetized where she'll be able to be intubated. And then so just make sure that everything's ready as far as with being able to intubate. What we generally do is tape the tube onto the lower beak in them. Generally have an additional person that is doing the monitoring of them while they are being anesthetized. It can be a little bit difficult, as you can see, with them being wrapped up in a towel as far as with being able to see them actually breathing. Sometimes you can see the bag actually move, but generally just by having that third person in the room where they can kind of just flip the towel aside every once in a while just to make sure that they're breathing okay is a good thing. I am watching her as well and can kind of feel her chest move as far as with her respiratory rate, and I can also somewhat feel her heart through the towel here on my hand, and just kind of watching as far as with her eyes here, her eyelids are starting to roll up, and so she's just starting to get sleepy, and you do need to kind of get them somewhat deep as far as with being able to get them intubated, because of course they aren't on any gas at that time that the mask is pulled off, and that will be intubating them. And then sometimes what we'll do too, just to remove the dead space, is we'll move them onto a smaller mask. I do have another one out just in case if we do need to do it. So once again, just being prepared with all of the equipment that you will possibly need is a great help. So it generally takes one person as far as with opening up and the beak and getting both the top and lower. The glottis pretty much sits right at the base of the tongue. It doesn't go in too far, as you can hear with her breathing that we are in. We're going to get her hooked up, give her a couple breaths just so she gets a little bit deep. And I'm trying to hang on to everything as one unit here so it doesn't move around and cause too much damage to the trachea. So we tape the endotracheal tube in like a catheter would be taped into a vessel on, say, for example, like a dog or a cat, and then we just tape that onto the lower beak. And you want to make sure that it's secure so it doesn't move around too much in the trachea if the bird needs to be manipulated at all during the procedure that they're having done to them. Good. And then what we're going to do is we're going to just briefly disconnect her from the anesthesia circuit and position her for the procedure that she will be having done to her. So generally, most procedures, they're on their back. We're going to get her rehooked back up for a minute, give her a couple breaths. As you could see, she was a little light and was breathing pretty heavily there. There's a number of different types of monitoring equipment that can be used on them while they are anesthetized. There's the pulse ox here. I can try hooking it up to her foot. With a darker pigment, sometimes it works and sometimes it doesn't work so good, and as you can see on her, she's got a black beak. That's an option there. Sometimes we can hook it up to the top beak if they have a white beak. That works quite well, or if they have pink feet, it works quite well. I'll try it on the foot here, even though her pigment is darker. It may not work, but we can give that a try. Provided that they're breathing very well on their own, we still give them a total of 4 supplemental breaths per minute. We also like to keep them on heat support, so we like using the bear hugger The handheld pulse ox here is actually working quite well on her. As you can see, this only goes up to 350. I'm sure her heart rate is probably a lot higher than that. That's maximum for that, but we are getting an oxygenation of about 98%, which is good. I usually like to add just a little bit of alcohol on that just to make sure that we're getting good contact with that. So this particular monitor here, the Veteran 6400 series, is a fairly newer monitor, and I like it a lot because it actually registers the heart rate, or on the ECG, the heart rate being up to 400 beats per minute, and has been quite accurate. So what I generally do is I get them hooked up to the ECG first. So the white lead, of course, goes on the right side, up onto the patagium up there. Black lead, left side, up on the upper patagium there. And then the right lead, I just generally go like right in the inguinal area right here. And as you can see, we're getting a pretty good reading and a waveform on that as well. The end-tidal CO2, this is a neonate one, so it measures quite effectively in a very small exotic species as far as with the respiratory rate and the end-tidal CO2. And then the third piece of equipment is the pulse ox. On the multi-monitor here, I find that it does pretty accurately pick up as far as with the SpO2 on them. So I'll hook that up to her other foot. Okay, give it a little bit of alcohol. And as I had stated before, because of her darker pigment, it's a little bit more difficult as far as with getting the SpO2. I'll try up on her leg here where she's missing some of her feathers, see if we get a better reading there. The only other piece of equipment that I really like using as far as with birds is the Doppler. And I will grab it over here. Put it right next to her. And on birds, you have a couple different locations that you can use it on. She's a little light. You can use it right on the basilic vein, right here on the inside of the wing. You can go up into the upper beak on the choana. Her opening is a little bit small up there on the palatine artery up there, or else you can use it on the medial metatarsal. With her having the shorter legs, what I find with most of the parrot species, using the basilic vein is the best for them. So you just kind of have to open up the wing a little bit. I'm going to position it this way. And then we use 2 tongue depressors with a piece of tape around it as far as with actually holding that in place. So I'm going to get that placed on her wing first, and then I'm going to turn it on and see where we're at. It should be right there. There we go. And as you can hear it, our heart rate's now probably over 400 on her. I haven't gotten an actual heart rate yet. So she's probably very close to 400 on that heart rate. So the last thing that we want to do with her before we wake her up is give her sub-Q fluids. And we go up in the inguinal area there. So by dousing the feathers down really well, it helps you gain visual access to that area. And what we're looking for is that nice flap of skin right there. So grab your fluids. And you want the bevel of the needle up. Just go right into the flap there. Inject, and you can see you're getting a nice bleb of fluid there. And just continue to go. They can actually hold quite a bit of fluid in that area there. So now that we're done with the procedure, we're going to wake her up. So just basically start disconnecting the monitoring equipment here. getting it out of your way, I am going to turn this off because it will start screaming at me that things are being disconnected. So turn that off. I'm going to turn the Doppler off. Remove that. Remove the end title. Okay. And then we're going to turn off the gas anesthesia. And then what I like to do right before I pick them up, as far as with them waking up, is actually disconnect them from the system, just so there's not a lot of movement with that tube in their trachea. Wrap a towel around them because they generally wake up wanting to flap their wings. And then untape the endotracheal tube, because it's probably going to pull a little bit of feathers and be a little bit painful if those are pulled off. And then until she's fully awake, I can just give her a little bit of extra oxygen here. And then with birds, they do wake up fairly quickly. When they wake up, they generally want to shake their head to try to shake that endotracheal tube out, and that's generally when we do pull it, right at that point. And I can feel she's getting lighter. As you can see, the feathers on the top of her head are starting to poof up. That means that she's getting light. I can feel her kind of shivering under the towel here. Her mouth is moving a little bit, her tongue is moving a little bit, so I'm guessing any second she's going to want that endotracheal tube out of her mouth. And she's starting to chew a little bit on it, so I'm going to go ahead and pull that. And then what we do is, until she's like fully awake, just put a little bit of supplemental oxygen, flow-by oxygen on, until she's completely awake and ready to go into a cage on her own. So we want to make sure that one person is designated as far as with monitoring anesthesia. That person's primary job is to watch the patient under anesthesia, make sure that they are breathing well on their own. Of course, we always give them the supplemental breaths while they are under anesthesia. And then the monitoring person, they want to use their stethoscope, go in every couple minutes, listen to make sure that the patient's heart rate is still maintaining within limits. And then also, as far as with the anesthesia form, primarily what they are monitoring is the heart rate, the respiratory rate, the end tidal CO2, and also the oxygenation, or the pulse ox, those readings on there. And we do take readings about every 5 minutes. Of course, if there's a more critical patient, you would want to decrease the time in between readings. The Doppler is very important. You can listen to that during the whole anesthetic procedure. Hear if there's any changes in that heart rate. If you noticed a trend as far as with heart rate or respiratory rate going down, then that generally means that the patient's getting a little bit deep. And what you want to do is you want to turn them down on the anesthesia until they're at a good level of surgical anesthesia then. And with blood pressure monitoring, we do have the ability, or the machine does have the ability, to measure blood pressure as far as with non-invasive blood pressure. Generally in birds, we found that it hasn't been quite as accurate. You can wrap that cuff around the wing, but it hasn't been as accurate. We don't have a whole lot of normals as far as with birds. We will do it in small mammals. Once again, as far as with our exotic companion mammals, we find it very difficult, if not very hard, to find a cuff that's small enough as far as with effectively monitoring it. Once they get a little bit bigger, over a few kgs, then of course we do use the smallest cuff, which is the size 1, and of course it goes up from there. It becomes a little bit more reliable at that point.